Happy Schema Therapy Day to everyone. Today we celebrate not only the model itself, but also the community of dedicated clinicians who continue to refine and expand this approach. Schema therapy is a journey of learning, both for us as therapists and for our clients. And days like this remind us to the importance of staying connected, inspired, and committed to our shared mission. Welcome and thank you for joining today. In this presentation, we will explore how schema therapy can be applied to complex somatic conditions, including chronic pain, irritable bowel syndrome, and functional neurological disorders. These conditions are often difficult to understand from a purely biomedical perspective, which leaves clients feeling frustrated, misunderstood, and unsupported. Schema therapy provides us with a framework to conceptualize these symptoms and address the emotional and developmental roots of persistent somatic disorders. Our focus will be on how familiar concepts such as schemas, modes, and unmet needs translate into work with this population. We will also look at how experiential techniques like imagery, rescripting, and chair work can be adopted to safely and effectively support clients with pronounced somatic symptoms. The objectives of this session are to introduce the rationale for applying schema therapy to complex somatic disorders and body focused work, to provide a clear framework for understanding how early maladaptive schemas and coping modes contribute to persistent somatic symptoms, to highlight the impact of trauma and attachment disruptions on bodily experiences and chronic distress, to present schema therapy approach to case conceptualization in this population, and to understand more practical experiential techniques, including chair work and imagery rescripting, adapted for clients with prominent somatic symptoms. Complex somatic disorders include chronic pain, irritable bowel syndrome, and functional neurological symptoms. These conditions are challenging because they often lack a clear biomedical explanation. However, neuroscience research shows that these symptoms are understandable. There are measurable changes in brain network responsible for pain processing, interoception, and emotional regulation. This is where schema therapy offers a valuable therapeutic entry point by addressing the underlying emotional and rational patterns that contribute to bodily distress. When we work with clients presenting complex somatic symptoms, a central topic is the exploration of unmet needs. Therapy often begins with the basics, helping clients recognize emotions, name their needs, and begin to build a clearer sense of identity. Even as therapy process and clients develop greater autonomy, we frequently return to this foundation. With increased awareness and lived experience, clients are able to assess a deeper level of self-understanding, often discovering new insights that were not possible at the start of therapy. In practice, this means supporting clients in differentiating their own feelings from those of others, strengthening autonomy, and encouraging independent experience. By gradually fostering identity development and self-expression, we help clients shift from habitual patterns of compliance and silence toward more authentic engagement with themselves and others. Research consistently shows that certain schemas are highly prevalent among clients with somatic symptoms. And recognizing these patterns allows us to conceptualize the case beyond the physical symptoms alone and to understand the psychological dynamics that fuel chronic distress. You can see schemas related to the need of attachment. Trauma and disrupted attachment histories play a major role in the development of complex somatic symptoms. These experiences shape how clients regulate emotions, relate to others, and even how they experience their own bodies. Very often, the body becomes the stage on which unprocessed emotions are expressed. Research across psychosomatic and trauma fields shows that adverse childhood experience and insecure attachment patterns significantly increase vulnerability to functional somatic symptoms. Clients with emotional deprivation or disorganized attachment often have underdeveloped strategies for emotional regulation. This dysregulation manifests through physical distress when emotions can't be verbalized or integrated. Impaired autonomy developed in is another factor. For example, clients who grow up in enmeshed or controlling family environments may lack a strong sense of self and body boundaries, leaving them prone to experience stress as physical pain or dysfunction. Neuroscience findings support this. Studies show the altered activation in brain regions responsible for interoception, emotional regulation, and the stress response in patients with these disorders. For schema therapists, the clinical implication is clear. Somatic symptoms are not random. They represent unmet needs and earlier relational injuries encoded in the body. Our task is to help clients gradually connect bodily sensations with underlying emotions while ensuring safety and stabilization. This provides the bridge between body experiences and schema work. We have highlighted quotes from the experiences of some of our clients who have various somatic symptoms, particularly back pain, abdominal pain, palpitations, and headaches. You may notice how the adult ignores and denies the childhood needs, as well as impairing autonomy and creating boundary confusion. In practice, we begin with psychoeducation to normalize the link between stress and bodily symptoms. Then we guide clients to explore sensations with mindfulness and relaxation techniques such as breath work or body scan. We can conceptualize symptoms as the part of a body mode, taking its history and even personifying an organ to better understand its function. Once validated, this mode becomes easier to approach with compassion rather than fear. Experientially, chair work can be used to dialogue with the body mode, and imagery rescripting can connect bodily symptoms to the vulnerable child. Often repressed anger surface here, and giving voice to the angry child is an important step toward integration. We have collected the areas there that are worth working with when dealing with somatization. You can pay attention to multifaceted approaches and complexity. To conclude, schema therapy provides us with a structured, flexible framework for working with clients who experience complex somatic disorders. It allows us to move beyond the outdated ideas of psychosomatic symptoms and instead recognize these conditions as meaningful expressions of unmet needs and disrupted attachment patterns. By focusing on those needs and strengthening the healthy adult mode, we can help clients reduce the severity of their symptoms, regain a sense of control, and improve overall well-being. As therapists, our task is to combine techniques thoughtfully while maintaining empathy, safety, and careful pacing in experiential work. This balance is what makes schema therapy both powerful and compassionate in supporting this client group. For those of you who would like to deeper your practice, our institute offers a range of advanced training opportunities in schema therapy. This includes specialist workshops focused on complex somatic disorders, borderline personality disorders, and trauma work, as well as structured supervision groups. We also provide certification pathways recognized internationally, so you can build your expertise step by step while receiving ongoing support. If you'd like more information, please visit our website or reach out to us directly. We'd be very happy to guide you towards the next stage of your schema therapy journey.